Do you know what to do when a sudden illness strikes?
Sudden illness may result from a condition that has a rapid or severe onset, or it may result from a persistent condition that continues or develops over a long period of time. Signals of sudden illnesses include changes in levels of consciousness, such as feeling lightheaded, dizzy, drowsy, confused, or may become unconscious.
Breathing problems, including trouble breathing or no breathing.
Signals of a possible heart attack, including persistent chest pain.
Signals of a stroke, including sudden weakness on one side of the face, sudden weakness often on one side of the body, sudden slurred speech, or trouble forming words, or sudden severe headache.
Loss of vision or blurred vision.
I can't see!
Sweating.
Abdominal pain or pressure.
Nausea or vomiting.
Diarrhea.
Seizures.
Signals of shock, including rapid breathing, changes in skin appearance, and cool, pale, or ashen skin.
Do no further harm. Monitor the person's level of consciousness and breathing. A change in the person's condition may be a signal of a more serious illness or injury. A condition that may not appear serious at first may become serious over time. Help the person rest in the more comfortable position. Keep the person from getting chilled or overheated.
Here, let me take that off for you.
Comfort and reassure the person, but do not give false hope.
Am I gonna be okay? You might be okay.
Give any specific care as needed.
Fainting is a temporary loss of consciousness caused by temporary reduction of blood flow to the brain, such as when blood pools in the legs and lower body. When the brain is suddenly deprived of its normal blood flow, it momentarily shuts down and the person faints. Fainting is not usually harmful. The person usually recovers quickly with no lasting effects. However, what appears to be a simple case of fainting actually may be a signal of a more serious condition. Care for fainting. Position the victim on his or her back, lying flat. Loosen any tight or restricting clothing. Check that the person is breathing. If the victim vomits, roll him or her onto their side.
Diabetes is the inability of the body to change sugar or glucose from food into energy. Signals of diabetic emergencies include changes in levels of consciousness, changes in mood, irregular breathing, feeling or looking ill,
I feel ill.
abnormal skin appearance,
Be careful.
dizziness and headache, and confusion.
Where am I?
To care for a diabetic emergency, give sugar in the form of several glucose tablets or glucose paste, or a 12-ounce serving of fruit juice, milk, a non-diet soft drink, or table sugar dissolved in a glass of water. Most fruit juices and non-diet soft drinks have enough sugar to be effective.
When the normal functions of the brain are disrupted by injury, disease, fever, infection, metabolic disturbances, or conditions causing a decreased oxygen level, a seizure may occur. Before a generalized seizure occurs, the person may experience an unusual sensation or feeling called an aura. An aura can include a strange sound, taste, or smell, or an urgent need to get to safety. If the person recognizes the aura in time, there may be time to warn bystanders or to sit down before the seizure occurs.
I'm gonna have a seizure! Oh no, sit down!
Symptoms of a seizure include rhythmic jerking of the limbs and head, loss of bladder or bowel control, confusion,
Where am I?
crying out, becoming rigid, holding their breath, rolling of the eyes upward.
Care for seizures.
Lucy.
To help avoid injury, you should move nearby objects such as furniture away from the person. Rarely, people who are having seizures bite their tongue or cheeks. Don't place anything in the mouth to prevent this. After the seizure passes, position the person on his or her side in a modified Haynes recovery position so that fluids can drain from the mouth.
Epilepsy is a common neurological disorder. People who have epilepsy often can control their seizures with medication. Those with seizures that are difficult to control may also be treated with surgical resection, which can be curative, or with implanted devices, such as the vagus nerve stimulator, which helps reduce seizure frequency.
A stroke, also called a CVA or brain attack, is caused when blood flow to a part of the brain is cut off or when there is bleeding into the brain. A stroke can cause permanent brain damage if not treated appropriately within several hours, but sometimes the damage can be stopped or reversed. Risk factors for a stroke are similar to those for heart disease. Some risk factors are beyond one's control, such as age, gender, and family history. Other risk factors can be controlled through diet, changes in lifestyle, or medication. Signals of a stroke include a facial droop or drooling, weakness or numbness of the face, arm, or leg, usually on one side of the body, trouble with speech,
Hey Olivia, how's the workout going?
loss of vision or blurred vision in one or both eyes, sudden severe headache. The person will not know what caused the headache and may describe it as the worst headache ever.
This is the worst headache ever.
Dizziness, confusion, agitation, loss of consciousness, or other severe altered mental states. Loss of balance or coordination, trouble walking, or ringing in the ears.
Call 911 or the local emergency number if you encounter someone who is having a stroke.
911, she's had a stroke.
If fluid or vomit is in the person's mouth, position him or her in a modified Haynes recovery position. Stay with the person and monitor his or her breathing and for changes in his or her condition. Wait until medical personnel arrive.
Now you know what to do if a sudden illness strikes.